Over the past few decades, there's been so many advances in the field of dentistry that provide patients with predictable and long-term solutions with the use of dental implants. Most patients, when they come in, they always think that implants will hurt a lot, but what happens is that the bone doesn't really have too much nerve endings. That's the first thing. Another thing too is we obviously anesthetize the patient. We also are very careful with our staff and everybody to make sure that our patients don't feel any pain. Most of the times we use some type of sedation. For patients who are not too anxious, we sometimes offer just nitrous oxide. That's just like a laughing gas that will make sure that they feel relaxed, and usually the procedure goes very well with that. Now, if you have patients who need a little bit more, what we usually do is we give them a type of oral medication. It's called oral sedation, and that oral sedation is what they do is they take a pill before they come, and that medication relaxes them. And what also happens with this is when during the procedure they're half asleep and they may not even remember what happened during that procedure. When it comes to larger cases, when we do several implants or we have to do a major surgery, what we also recommend most of the times is to do an intravenous sedation. That's called a moderate sedation, or it's a moderate conscious sedation. And what we do is we give the patient the medication, they usually fall asleep, and when they wake up, they already have a beautiful smile. And patients are surprised when we finish the surgery and they barely had any discomfort. Most of the times they don't even have to take any pain medications if it's just a single implant or so. We're very fortunate that we have all the technology to make sure that our procedures are minimally invasive. And that's really important for us. And I think that's important for the patients too, because they clearly see that they don't have so much pain as when they go to some other practitioners who have to do a more aggressive flap to make sure they can see where the bone is, or they may not have the same experience as we do. Since we are more experienced, we do this on a regular basis. I'm a board certified prosthodontist, so I've been doing this for many, many years, so I think that really helps a lot. I would be happy to answer if you have any questions for us. We have a wonderful staff that can answer most of the questions when it comes to dental implants or major mouth reconstructions. And we offer also a free consultation and a free CBCT scan for all the patients that want to have like a second opinion. Please feel free to reach out to us at elandentalgroup.com.